Welcome back to DP60. Today we have a CPC of retiform purpuric lesions on the lower legs bilaterally of this patient. Importantly, this patient has a history of end-stage renal disease and calciphylaxis was high on the differential. The lesions were not super painful to the patient, but there was some degree of pain. You can see this sort of retiform or kind of net-like scalloping at the borders of all of these lesions. Biopsy findings, interestingly, showed epidermal necrosis as well as necrosis of eccrine glands, as seen on higher magnification here. You can see the necrosis of the epidermis with early separation of the epidermis from the dermis. And here's an eccrine gland that has necrosis of the cells. The clinical differential did include calciphylaxis, and there was not calcium within vessels deep down. And on another section, there was perhaps one vessel in the dermis that looked a little bit occluded, just like right here. Maybe there might be a little bit of occlusion and destruction of a vessel right here, but no clear occlusion or calcium within vessels. Because of the end-stage renal disease, calciphylaxis was highly suspected, and there was another biopsy a day later that did show calcium in the fat within vessels. So can you guess the diagnosis? Yes, so this is a calciphylaxis. And just to remember that early lesions of calciphylaxis that are not diagnostic completely may just show necrosis of the epidermis and or the eccrine glands and perhaps have hints of vascular occlusion, but no clear calcium within vessels, and another biopsy can be helpful, or radiologic studies to show calcium within vessels can also be helpful. Thanks for listening today.